Hello guys, today I'm going to give you instructions on how to take this saliva hormone test kit, which you will do at home. So if you're watching this, you've either purchased this test from me, or you could also use this as instructions if you're going directly through Access. Okay, this kit contains a few things. Number one, the client form. I highlight for my clients what it is that you need to fill out. You only need to worry about filling out what I highlight. The lab knows exactly what to do with the rest of it. So that's going to include name, date, date of birth, and then you'll need to remember to sign it on the bottom. Don't worry about anything else on the back, only what's highlighted. Make sure this goes back in the box so that the lab knows what kind of sample they're getting and who it belongs to. So there are two different kinds of kits that you may have received. The 5-tube saliva test kit has 5 small tubes, and the 4-tube kit has 4 larger tubes. So either way, you're either spitting 4 times or 5 times, so you'll just do the amount of tubes that is in your kit. When you open up this trifold brochure, it's going to tell you all the times that you need to be taking your saliva samples. So you are going to take a sample at between 7 and 8 a.m., 11 a.m. and noon, 4 and 5 p.m., and then 10 p.m. to midnight. If you have a 5-tube kit, you'll also need to take a 3 a.m. sample. So if you're doing the 4, you're doing less amount of times. You'll want to just set your alarm for all those different times. That's the easiest way to not mess up doing it. What you will do is when your alarm goes off, you're going to open your tube. If you just sit with your mouth open for about 30 seconds to a minute, you will start to drool intensively, and then you will just dump to fill your tube. It is incredibly important that this tube is filled to the top, especially if it's a little guy. If you have the bigger tubes in the 4-tube kit, you can kind of just fill it almost to the top because it does take a lot to fill that. You will then close your sample. By the way, it tells you what time each color relates to, right? So the green tube is your 7 to 8, blue is 11 to noon, yellow is 4 to 5 p.m., and red is 10 to midnight. So this is the 10 to midnight tube. After you spit, you seal it. If it's frothy, you can kind of just tap it. Sorry, you can't see that. You can kind of just tap it to get the bubbles out, but it's really important that we have clear fluid saliva and that we don't have any mucus or bubbles. Then you're going to make a label. You will just put your name, your date of birth, the time, and the date. You will label your tube, and that sample goes back in the bag and put that in the refrigerator. And then you will repeat this either 3 or 4 times depending on the kit that you have. Make sure you spit first, label later in case you get spit somewhere, or in case if it does happen to turn out really mucusy and you need to spit it out, you can rinse it out with water, let it dry, and then spit again. Really important, this little guy, this card, gives you some other tips about taking this test. So notice how it says that the tube must be filled to the top. Again, I want to reiterate, if you're using a small tube, it needs to be like overflowing full. If you're using a larger tube with the 4-tube kit, you can just get it almost to the top and that's fine. It's a lot bigger tube. Notice how it says no food or drink 2 hours prior to collection time. This is not talking about water. In fact, you need to be drinking a lot of water during this process so that you don't get dehydrated and you won't have any saliva to spit. So water, water, water. Water is okay. When they're talking about drink, they're talking about tea, coffee, soda, juice, and obviously solid food. The reason for that is if one of these tubes comes back contaminated with even the smallest piece of food, they're going to kick back the sample and we have to retake that tube time and repay for it. So be cognizant of that. And then also, if you happen to be on supplemental hormone therapy, not with me, but something synthetic, you would want to stop during the time that you're spitting. That way it's not picking up on that extra hormone level in the body. I think that is all I want to say about the tubes. Okay, so everything is in the fridge. When it's full that morning, you're going to stick everything back in your box. And then this is a pre-addressed UPS label. This is. So all you do is stick your box in here, put it in here, and then take it to UPS. And this gets second day aired to the lab. This is a specialty lab, and it takes about 7 to 10 days to get your results back. I did want to go over all of the things we're getting back in this test. I'm going to go ahead and put this up on the screen. This is a lot more comprehensive than blood, and we're getting a lot more details and a lot more accuracy compared to blood. And the reason for that is because when you think of the body, the hormones are in the blood as the road that they're taking to the glandular system. And it's actually the glandular system where they're active. So taking blood isn't really a good picture, in my opinion, of what's really going on in the endocrine system. And I think most really good endocrinologists will only use saliva. So because saliva is coming from a gland, we can get a nice scope of what's going on with the hormones. Okay, so we are getting in this test estrone, estradiol, and estriol. These are your estrogens. Progesterone, DHEA, testosterone, DHT, and then we're getting 4 to 5 cortisol samples. So the AM, and that ranks back to the stomach. The noon cortisol is vectored to the heart. The evening cortisol to the bladder. The nighttime cortisol is the thyroid, adrenal, pituitary, hypothalamus, and sex glands. We also look at, if you had 5 tubes, we'll get the liver cortisol time. We also look at melatonin, 17-OHP, and androstenedione, which would be an indicator of potential PCOS. So this truly is a very in-depth saliva test to look at all of the hormones and the cortisol levels. It's incredibly accurate, and I absolutely love using it. So hopefully this is helpful for taking your test kit at home. And if you run into any trouble during this time, please reach out to me. Thank you for listening.